Hello to all the viewers. I bring greetings from Project Adhuna of Foxy. Today we are going to have a panel discussion and we are going to talk about various aspects of labor care. I have 9 eminent panelists with me today and they are going to answer to all these important questions which I am going to pose them. My first question is to Dr. Rupali. Can you please give us brief introduction about quality of care and positive childbirth experience?
So today is the era of giving quality care in all sectors, and health sector should not lie behind and give quality services to all its patients, and obstetrician should give a positive childbirth experience to all of its patients. And for the health system to give high quality care, there should be good resources, guidelines and policies that should work in hand in hand to give high quality care to the patients. For high quality care, there should be both some provision of care as well as experience of care, which are both pillars of the high quality care to the patient. And for provision of care, there should be evidence-based practices. The doctors should do all the evidence-based treatments to modalities to the patient so that they get best care. All the actions of by the doctors should be informed to the patient, and the patient should know the course of treatment so that the patient is in confidence and gets all the information with time. And in case of any complications or where there is any lacunae, the patient should be referred timely to good centers where the patient can be managed for all those complications. And for experience of care, there should always be a very good two-way communication between the patient and the healthcare provider. The healthcare provider should understand the patient needs and should give best of his quality services. There should be respect and dignity of the patient's demands as well as his needs, and supportive care by the healthcare providers understanding the emotional need is much more required. Also, thus both competent, motivated health resources and essential physical resources are both required to give high quality services by the health system.
Right. So our basic aim is to improve the quality of care. Dr. Mudita, can you tell us about what are some of the best practices that can improve the quality of care, especially for the private sector?
Thank you very much, sir. So the best practices we should include in our facilities, as we all know that we deal with women, so every woman is important for us. So our facility should be women oriented. All females should feel safe with a good environment, and the facility should be efficient and to help them provide a dignified services, because this is the right of every female to have high quality care. So this, along with that, all SOPs should be placed everywhere in the emergency department. SOPs for any type of emergencies, A, B, C, D, and to follow the SOPs we need to have proper HR department which can provide us with a team. So our team should have one leader which can dictate all the instructions, and another team people should be there who can follow his instructions. Along with teamwork, integrated teamwork, like we should have all types of physicians, ancillary nurses, other department if required should be available on calls. The documentation should be there. Whatever you are providing to the patient, everything should be documented. Along with that, a communication skill should be there. So one person should be communicating with the person relative, and the third person should be communicating in between the teams. So for that, a proper team leader is required. And whatever we do, we must do an audit in our facility, because we should know what are our positive aspects and what are our negative aspects which we should be improving.
Right. So let's first now talk about intrapartum care. And my question to you, Dr. Priyanka, can you elaborate on some of the tools that can be implemented to improve quality of care in the as a part of intrapartum care.
Thank you, sir. Thank you for giving me the opportunity to answer the question. We all know that WHO and SDG goals are to reduce maternal mortality and neonatal mortality. And for this, early identification and treatment of complications are critical for preventing adverse birth outcomes. So how can we identify these problems early? If we go back to the history, we date back to Mr. Friedman, who developed a sigmoid curve which shows that cervical dilatation follows the golden rule of 1 centimeter per hour, even if it is the slowest in active management of active stage of labor. After that, Philpott and Kessel developed the partograph in the early 1970s. The partograph is a graphic tool in which we chart the labor progress on 2 axes. The x-axis shows the length of labor in hours and the y-axis shows the cervical dilatation. So key features of this tool were that we had developed 2 lines. One was the alert line and the action line, which actually became an easy guide for anybody to understand that you should be alert at this moment and start active intervention at this moment. So what were the active interventions? Then O'Driscoll and colleagues proposed during the 1970s the active management of labor, which is a package of interventions which aimed at reducing the proportion of women with labor progressing at cervical dilatation rates lower than 1 centimeter per hour, like oxytocin infusion and other things. So now in this era, we are with Adhuna project, and now we talk of the WHO Labor Care Guide, which is most frequently used and would be elaborated by my other panelists.
Thank you, Dr. Priyanka. You've raised a very, very valid point about the labor care guide. Dr. Niba, can you elaborate a little more about the labor care guide? When should it be initiated and in which situations it should be used?
Yes. Thank you, sir, for asking me such an important question. Labor care guide, it really needed, and it's important for providing a comprehensive and individualized care to each patient who is coming in labor. So WHO has given us a labor care guide which provides us with 7 important sections. So the first and foremost is identifying information about the pregnant woman and details of the labor when the patient comes in labor. So with all these details, we have the baseline care for the pregnant woman. And then we have the supportive care. With this point, we ensure that each pregnant woman who comes in labor should get the continuous support and emotional support throughout her labor, so that she has a very good birthing experience, a positive feeling about her giving birth to a baby. Then the third one is care of baby, which is very important. We must ensure that throughout labor we take care of the intrauterine fetus, and finally the baby after delivery is in very good health. So during labor and during delivery we should take care all aspects of the baby. Then we have care of the woman. We must address the assessment and care of the mother, including all vital signs of the patient, ensuring her safety and well-being. Then comes the details of the labor, progress of the labor. So we have to see about the contractions, about the dilatations and descent of the fetus, so that we know that the progress of labor is smooth and we can interfere at right time. So progress of labor is very important, so that's included in this labor care guide. And after that, regarding the medication, often we provide some analgesics or some medication for acceleration for the labor. So these all should be documented so that we can be sure that whatever we are giving, that is safe and it's proper. Last but not the least, that the decision making, whatever we are deciding, whatever the healthcare provider is deciding about the progress of the labor and the final outcome, that should be shared between the healthcare provider and the pregnant woman, so that patient is really satisfied that whatever is being done, that whatever is the final output, it's good for her. So this labor care guide should be followed in all the labor rooms, whether it's private or it's government, and it should be started being followed at the beginning of the labor. Whenever the patient comes in labor, we should follow this labor care guidelines, so that the happy ending of the labor is there always.
Right. Thank you, Dr. Niba. You've talked about the labor care guide in a perfect manner, but then we have to ensure that systematic and consistent application of labor care guide should be done. Dr. Arunachal, can you throw some light on this point?
Thank you, sir, for the question. To successfully integrate the labor care guide in private healthcare settings, the following steps are required. First, awareness and advocacy. The first step is to create awareness among healthcare professionals, including obstetricians, gynecologists, midwives, and paramedics. Second is institutions must emphasize the importance of structured, evidence-based labor monitoring through LCG. Second is training and capacity building. In training and capacity building, regular training programs should be conducted for healthcare providers to ensure the understand and effectively utilize the LCG. This training should focus on interpreting and documenting labor progress, ensuring all team members follow a standardized approach. Third is integration into case sheets and hospital records. The labor care guide should be incorporated into all patient case sheets, making it a routine part of documentation in private hospitals and clinics. This ensures continuity of care and helps in monitoring the labor progression in systemic manner. Fourth is real-time monitoring and compliance. The LCG should be reviewed at regular intervals during labor, ensuring that the data recorded is real-time and accurate. It is crucial that the guide is not filled retrospectively, as this could lead to incomplete or inaccurate information that may compromise patient safety.
Thank you. We all know that respectful maternity care is an important aspect when we talk about quality of care in childbirth. Dr. Lata, can you elaborate on this point?
Thank you, sir, for asking me this question. Every pregnant lady has got the right to have respectful maternity care. We should see that she gets a high quality care with dignity and compassion and love. So let us go into detail what all we can do for this lady. What is dignified care? Every woman should be treated with respect, whatever may be her background, whatever may be her social status, or whatever may be her medical conditions. These women must be fully informed about any medical procedures. Their consent should be taken before any interventions. Then coming to the confidential care, protecting the privacy of the pregnant woman during labor and delivery is very much necessary to give a positive birth experience. Non-abandonment in care. We should never leave these women alone in the labor room. She should not feel neglected. There must be always continuous emotional support to be provided to these ladies. No physical abuse. Any form of mistreatment, physical abuse is not acceptable. She should be treated with care. Just because there are financial constraints, it is not that she should not receive the proper care during the childbirth. All women, regardless of their socio-economic conditions, whatever may be the finances, they must be given equal care, and quality of service should be same to all the women. And coming to the cultural sensitivity, we must we must respect all their different traditions, beliefs, values which will surrounding the childbirth. Some people follow, like before cutting the cord, they show the baby to the husband, and sometimes they give feeding after asking the pandit. So though these rituals are, we feel they are silly, but we must respect their culture. Emotional support, it is very, very important to give emotional support during the pregnancy and childbirth. We must show empathy, reassurance, psychological support, so that the mother feels a positive attitude and the outcome is very good. By embracing respectful maternity care, we can create a safe, supportive environment for these women, ensuring that the childbirth is just not a medical experience, but it is a dignified and empowering journey. The mother herself should respect her pregnancy, because we do see these women not taking care of themselves. Unless they take care of themselves, respect themselves, no one can help. So I feel respectful maternity care must be given to all the pregnant ladies, which is very, very important for the positive outcome.
Thank you. Respectful maternity care is so important not only in public sector, but it is also important in private sector. And let's not forget that obstetrician's role doesn't end here. There's much more to it. And Dr. Bharati, I want you to tell us about how respectful maternity care can be extended to counseling and providing postpartum family planning services.
Thank you, Dr. Parag. And very relevant questions in especially Indian scenario, that respectful maternal care, it should be considered. Always keep in mind that we have to counsel the woman for the contraception, and we will try to give her all options and help to her to choose the contraceptive method whichever she wants. So after postpartum contraception, we have to see whether woman is breastfeeding or not. If woman is not breastfeeding, then we can start almost all contraceptive methods as early as possible. And if we talk about the implants, intrauterine contraceptive device can be started immediately after delivery. Besides that, if even progesterone only pills, condoms, injectables, they can also be given after delivery. And even if women wants permanent contraception methods like female and male sterilization, that can also be given as early as possible. And if we talk about the emergency contraception, then definitely should not be a regular contraceptive method. We have to give her in a special situation. But now if woman is breastfeeding, then of course we have to keep in mind the effect of contraception on lactation as well as neonatal health. So of course we can give IUCDs, intrauterine contraceptive device, and implants immediately after delivery. We can give condoms, we can give progesterone only pills also after delivery. Injectables contraception, as in the family planning government scheme, it is available with the name of Antra, that can be given after 6 weeks of delivery. And if we talk about the combined oral contraception pill, then in the breastfeeding mothers, it can be given, or it should be given after 6 months of delivery, so that it doesn't affect the lactation. And again, in the emergency contraception, it should not be a regular method of contraception. It should be given in the medical supervision under certain conditions. That's about the contraception option.
Thank you, Dr. Bharati. In fact, you've given us the entire spectrum of contraceptive baskets, how to use it, when to use it, and how to use it correctly. Our care doesn't end here, because we also have to look after the newborn. And Dr. Rakhi, what are the essentials for preparedness for immediate newborn care?
Thank you, Dr. Parag. Actually, as soon as the baby is coming out, we should be well prepared with all the neonatal resuscitation and all the equipment for welcoming the newborn coming there, and to stabilize in any of the OT. The neonatal corner is very well prepared, where there will be the room temperature of the labor room has to be maintained to somewhere around 23 to 25 degrees centigrade, and there should be a radiant warmer to welcome the baby, and the air humidifier should be there. Apart from that, you should have a working umbu bag and a mask present over there in case the baby requires any resuscitation. Then the working stethoscope is important for the to see the heartbeat, how is the baby, and the oxygen supply needs to be there in case the baby is having difficulty in breathing. So the oxygen has to be maintained and resuscitation for that, and a shoulder roll position to correct the airway for the baby, and a hot towel and a clean towel has to be there to wipe the baby around and maintain the warmth of the baby so that the baby is healthy enough, and the clamps and the cord care has to be there in place. The glucometer has to be functional to see if required, if the baby is small for gestational age babies which have been delivered, or the low birth weight babies. So the glucometer in the OT has to be in place. Then kangaroo mother care and has to be instilled, and awareness has to be there for that, so that for the low birth weight babies or the baby having less than 2.5 kg weight, in that kangaroo mother care has to be instilled to the baby. And vitamin K injection should be in place in case there is excess amount of bleeding, then that can be tackled very easily with that. And collection vial should be there in case the mother is Rh positive, negative, so the cord blood collection has to be there so that the baby's blood group is known, and the referral protocols have to be in place in case the baby has to be referred immediately to the higher side or the NICU. There that protocol has to be in place, and the sister, the nursing staff and everybody should be knowing about it.
Thank you. When we talk about neonatal care, the most essential practice is about breastfeeding. Dr. Sadhana Sinha, can you talk about breastfeeding and neonatal care?
Thank you, sir, for the question. Sir, healthcare systems, they are prepared to help mothers for successful breastfeeding. There are certain hospital policies. Hospitals should implement strong breastfeeding policies that are communicated to all healthcare staff. The staff should be competent. Healthcare providers must be trained and competent to support mothers in initiating and maintaining breastfeeding. During antenatal period, when the patients are coming for the visit, it is our responsibility to train the mothers to explain what is the importance of breastfeeding. Care right after birth, skin to skin contact and early initiation of breastfeeding within the first hour of birth, it should be initiated. Support mothers with breastfeeding. Provide practical support helping mothers learn proper positioning and latching techniques. Rooming in mothers and babies should stay together 24/7 to facilitate bonding and feeding on demand. Responsive feeding. Mothers should be encouraged to breastfeed based on baby's hunger cues and not a strict schedule. Bottles, teat and pacifiers, these things should be avoided. These can interfere with breastfeeding success and should be discouraged in early stages. Mothers should receive ongoing breastfeeding support through follow-up care, community program and lactation and counseling. However, there are patients who do not wish to breastfeed, and that should not be stigmatized. They should be taught properly how to feed formula properly to the baby in a safe and hygienic manner to ensure that the baby gets adequate nutrition. And there are benefits for the mother. Breastfeeding helps in involution of the uterus, allowing it to return to its pre-pregnancy size faster. It delays pregnancy, as exclusive breastfeeding can serve as a natural method of contraception. Breastfeeding, it lowers the risk of breast and ovarian cancer, offering long-term health protection. It decreases the mother's workload as breastfeeding is convenient and eliminates the need for bottle preparation. It has got benefits for the family and society also. It saves money as it eliminates the cost of formula and feeding supplies. Promotes family planning as lactational amenorrhea can act as natural contraceptive method. It decreases the need for hospitalization as breastfed babies are healthier and have few infections. It contributes to child survival, reducing infant mortality rate worldwide.
Thank you all the panelists for insightful answers to various issues related to quality of care and respectful maternity care. And for viewers, please listen to all these answers very carefully. If you follow whatever is discussed here, it will be a great experience not only for the mother, for the neonate, but for you as obstetrician, because it will be very satisfying that you have given best possible care to the new mother and the newborn. Thank you very much.
Thank you.
Thank you.